A dietary directive was adopted as national policy. It quietly became the foundation of meals and grocery shelves. Its health effects only became visible in statistical trends years later. This shift was part of a process that has repeated itself in other ways. By the early 1980s, the nutritional landscape had already been reshaped by federal guidelines that seemed inevitable, scientific, unquestionable. The food pyramid, the low-fat directive, the warning against saturated fat. These weren't framed as theories still under investigation. They were presented as conclusions. And once presented that way, they became infrastructure. Grocery stores reorganized their shelves. School cafeterias rewrote their menus. Doctors handed out pamphlets that repeated the same core message. Fat was the enemy. Carbohydrates were safe. And if you followed the guidelines, you were doing the responsible thing. The language was gentle but absolute. It didn't invite debate, it invited compliance. What made this shift so effective wasn't force, it was repetition. The same advice appeared in medical offices, on television, in magazines, in textbooks. It became the kind of knowledge that didn't need to be questioned because it seemed to come from everywhere at once. And when something comes from everywhere at once, it stops feeling like a recommendation. It starts feeling like reality. Most people didn't notice that the evidence behind these guidelines was less solid than the confidence with which they were delivered. There had been studies, yes, observational data, correlations, but correlation had been treated as causation, and uncertainty had been smoothed over in the translation from research to policy. By the time these directives reached the public, they had been stripped of nuance, doubt, and complexity. What remained was a message simple enough to fit on a poster. And so it spread, not because it had been proven beyond question, but because it had been repeated beyond question. This wasn't discussed openly. The gap between the science and the messaging wasn't something the average person had access to. It wasn't something they were encouraged to look for. The system didn't build in space for skepticism. It built in space for trust. And trust, once established, is difficult to retract. Children growing up in this era were taught these principles as fact. Fat makes you fat. Whole grains are always better. Eat less, move more. The advice was woven into health class, into doctor's visits, into the way families thought about meals. It became common sense. And common sense, by definition, doesn't require proof. It simply is. But what happens when common sense is based on assumptions that were never fully tested? The real impact appeared years later, not immediately, not in a way that could be traced back to a single policy change or a single recommendation. It emerged gradually, in patterns that were easier to see in aggregate than in individual lives. Rates of obesity began to climb, not slowly, rapidly. Type 2 diabetes, once considered a disease of older adults, started appearing in children. Metabolic syndrome became a term that doctors used more and more frequently. And the strange thing was this: people were following the guidelines. They were eating less fat. They were eating more grains. They were doing what they had been told to do. And yet, the outcomes kept worsening. By the time researchers began to seriously question whether the low-fat approach had been a mistake, the damage was structural. Entire industries had reorganized around these guidelines. Food manufacturers had spent decades engineering low-fat products, which often meant adding sugar to compensate for flavor. School lunch programs had locked in contracts based on the pyramid's recommendations. Nutritional education had become standardized. Reversing course wasn't just a matter of updating the science, it was a matter of dismantling systems that had become self-sustaining. And so, the guidelines persisted. Even as evidence mounted that they might be wrong, even as alternative frameworks began to emerge, the official message remained largely unchanged for decades. Because changing it would mean admitting that millions of people had been given incorrect advice, that the trusted institutions had been wrong, that the system had failed. And systems don't like to admit failure. This wasn't the fault of individuals trying to eat well. It wasn't the fault of parents packing lunches, or teachers explaining the food pyramid, or doctors repeating what they had been taught in medical school. It was structural. It was systemic. It was the result of decisions made at levels far removed from the dinner table by people who were optimizing for consensus and simplicity rather than accuracy and humility. The guidelines were designed to be universal, one size fits all, easy to communicate, easy to enforce. But human metabolism is not universal. It's variable, complex, influenced by genetics, by environment, by individual history. And when you try to compress that complexity into a simple set of rules, something gets lost. What got lost was the understanding that nutrition science is not settled, that recommendations should come with caveats, that what works for one person may not work for another, that absence of evidence is not the same as evidence of absence. But none of that uncertainty made it into the public-facing message. The public-facing message was clean, confident, definitive. And because it was definitive, it was believed. There's a moment many people have, sometime in adulthood, when they realize that something they were taught as unquestionable truth was actually just the best guess of the people in charge at the time. For some, it happens when they try to lose weight by following the old guidelines and find that nothing changes. For others, it happens when they read newer research that contradicts what they learned in school. For others still, it happens when they notice that the experts themselves have quietly started to shift their language, without ever explicitly acknowledging that the previous language was wrong. That moment of realization doesn't always come with anger. Sometimes it just comes with a quiet sense of betrayal. Not directed at any one person, but at the idea that the system was supposed to know, that the authorities were supposed to be right, that trust was supposed to be rewarded with accuracy. And when that trust breaks, it doesn't always rebuild. What replaced real food science wasn't malicious. It was overconfident. It was the belief that early observational data could be treated as absolute truth, that complexity could be simplified without loss, that a single set of guidelines could serve an entire population, that good intentions were enough. They weren't. By the 1990s, the low-fat era was fully entrenched. Snackwells flew off the shelves. Fat-free everything became a status symbol, a marker of discipline and health consciousness. People felt virtuous eating foods that had been engineered to meet the guidelines, even when those foods were loaded with sugar and refined carbohydrates. Because the guidelines said fat was the problem, and if fat was the problem, then removing fat was the solution. It was a logic that worked on paper, but bodies are not paper. The consequences didn't show up in a single generation, they accumulated. Children raised on low-fat diets became adults with metabolic issues. Adults who had trusted the system found themselves sicker, heavier, more confused. The foods they had been told were healthy hadn't made them healthy. The behaviors they had been told would protect them hadn't protected them. And when they asked why, the answer was often, "You must not be doing it right." Not, "The guidelines might be wrong." Not, "The science might have been incomplete." Just, "Try harder, eat less, move more, follow the rules better." The system didn't leave room for the possibility that the rules themselves were flawed. It's worth noting that this wasn't unique to nutrition. It was part of a broader pattern in public health, in policymaking, in the way institutions relate to uncertainty. When faced with incomplete data, the instinct is often to project confidence anyway, to offer a clear answer, even if the evidence doesn't fully support it, because clarity is reassuring, and people want to be reassured. But reassurance without accuracy is just a delayed form of harm. The guidelines weren't updated in any meaningful way until 2015, more than 3 decades after they were first introduced. And even then, the updates were incremental, cautious. The message shifted, but it didn't reverse. Saturated fat was no longer public enemy number 1, but it wasn't exactly exonerated either. The emphasis on whole grains remained. The underlying framework stayed mostly intact. Because systems change slowly, especially when admitting error is perceived as weakness. And so the new guidelines coexisted with the old ones. People who had spent decades avoiding fat were told that maybe fat wasn't so bad after all, but not in a way that acknowledged the years of conflicting advice, not in a way that rebuilt trust, just in a way that quietly shifted the conversation and hoped people wouldn't notice the contradiction. Some people did notice. And similar decisions followed. The way sugar was downplayed while fat was demonized. The way entire food groups were reframed based on incomplete evidence. The way profit and policy became difficult to separate. The way voices questioning the consensus were marginalized, dismissed, or ignored until the data became too overwhelming to deny. That pattern didn't stop with nutrition. It didn't stop in the 1980s. It's still happening now, in different forms, in different fields, wherever certainty is valued more than honesty, and wherever systems prioritize their own stability over the people they're meant to serve. And this wasn't the only change.